the European health data space and the way that we are giving citizens access to their data in Denmark is a quite interesting thing. So the question is, of course, are we ready for the Article 3 in the Danish context? And I will focus to my presentation on the two first points: the citizens' right to have access to their data, and also their right to have an electronic copy of their data, and give my suggestions to how the national portal can be a player in that context, or is a player in that context. But maybe first a short introduction to the portal and the context in Denmark. You could say, seen from a Danish perspective, we are maybe in a good position when it comes to the implementation of the European health data space, or we are in a difficult position because we have been working with the interoperability and the transfer, the use of data across the different healthcare sectors in Denmark for close to 30 years, where we have had national, regional, and local solutions for data exchange in the healthcare system. But we are in a good position because we have a strong national infrastructure, and we have a long-term experience with giving patients access to their data and to exchange data between the different parts. Even though that Denmark is a small country with around 6 million inhabitants, doesn't mean that we can't make it complicated. So we have a number of players in the Danish healthcare sector. Also means that we have a lot of issues around interoperability and exchange of data. We also, and I think that's also important when we go to European level, is that this is also a cultural question. It's a question of trust. And in Denmark, we are blessed with the situation that we actually have a culture of trust where the citizens trust the government. They trust that the public sector takes care of the data and use them sensibly, and that we do it for the best of the patient and in their best interest. And that has been quite important in the building of the Danish healthcare sector solution, that we have always been able to work in this environment. In Sundhed.dk, the national portal, we have this vision that we would like to be a user-centered universe that creates value and coherence for both healthcare professionals and the citizens, supporting the empowerment of the citizens in their meeting with the healthcare system. So we are providing data access across sectors for both healthcare professionals and the citizens in their daily life. In brief, you can say we have two main tools for giving access to data. We have our web page, where you have quite large and some would say sometimes a little complicated web page, where you can find both your personal data, but you can also find a lot of the official information and the validated information about diseases, treatment process, and so on. So that is the validated, official, authorized information that you can find there. And then we have our app, My Health, where you can find a slim version of the information that are in the portal. This means your personal data and some of the official healthcare information also. So that's our two main tools to give citizens access to their data. What you can find in the portal is all information from hospitals, some information from the primary sector about you, and we are still increasing the number of sources that delivers information to that. So you can find information about your appointments, your lab results, your your prescriptions, your medication, your discharge letters, referrals, and so on. So that's one important part of the portal, is that you can go in and see what are my latest results and my latest interaction with the healthcare system. There is also a number of services that you can use, so you can give consent. You can give access rights to relatives to your data. You can donate organs, and you can do a number of other things. And most importantly, you can also go in and see who has been looking at your data. So if any healthcare professionals that shouldn't have been looking at your data has done it, you can follow the log in the portal. So basically, you can say the first part of the Article 3, can you get access to your data? Yes, you can do that by logging into the portal, and you can see all the data that the healthcare system, or more or less all the data the healthcare system has about you in a Danish context. Now, that's just. And are people using that? To log in and see your own data, you of course need to use the national login that is based on your social security number. So you get into the closed area, and that has been used a lot over the years. But especially the Corona crisis gave a huge kick to the use of the portal. And suddenly everybody in Denmark has been in and looking at their data, because during the Corona crisis, you could find your Corona passport and your test results on the portal. So it has given us a huge spark in the number of citizens that are using it. The same goes for my health, our app. We had a steady growth, but suddenly it has been downloaded now more than 6 million times. So more or less every Danish citizen has the app on their mobile phone today and has been using it primarily for Corona. But after Corona, we have doubled the number of daily users before. So people have realized that they can get their access to their healthcare data through that. The same goes for the healthcare professionals. They can log in and see data on patients if they have the right to access the data. But they can also go directly from the electronic medical record systems. All the different medical record system has a link where they goes directly to the portal with the context of the specific patient included. So they go there and see the information about that patient that they are taking care of at that moment in time. The way it's built is that the portal don't have any data. We are just extracting data or showing data that is stored in the many different systems in the Danish healthcare system. So we have today around 170 different integrations where we are pulling data out of the system and showing it to the citizens. So we are only providing a view access to the data for the citizens and the healthcare professionals. So there's no central storage of the data in the portal. I think that's an architectural choice that we made nearly 20 years ago in Denmark when we decided to build it this way. It has been functioning quite well, and it's in a way easy to add new services to the portal in that way that we just need to have one integration to the portal, and we will adapt to the different systems. It's also something that we have built step by step. We haven't been making this up from the beginning. It started with a few data and then has been increasing over the years. So it is an integration platform that can add new services and new data all the time. And in that way, you can always get access to new services and new data as a citizen when you go there. So are we ready? Well, to some degree, yes, you can today go into the portal and get your data, and you can print them out. You can get them in a PDF. So Is that electronically? To some degree. At least you have access to the data. Are they transferable, transportable to other systems? No, not yet, but in principle, it would be possible for us to create a button for the citizens to download their data in any format that it would be decided. So technically, it's possible. Political might be difficult. So thank you.